Okay, sorry about that, guys. Hopefully you can see me now and hear me now. So I'll just wait for you guys to join and then we'll get started. Hi there. Sorry about that. I had a little bit of technical issues, but hopefully you can now see and hear me. So we'll just wait for some more viewers to join and then we can get started. Hi, everyone. Sorry about that. I wasn't able to get my audio working properly, but hopefully you can hear me now. Okay, so we'll just get started with answering some of the questions. I know a few people came and probably haven't logged back in, but I'll read the questions out and start answering, and then hopefully some of the other viewers can revisit this video once it's up on my channel. So the first question is, I graduated as a doctor in the year 2005, and my primary medical degree and education are recognized in Canada. Therefore, I have practiced in anesthesia and ICU for 11 years. Okay, that's good. I wasn't. Is that a question? Did you have a question, Samantha? So I'll finish off Samantha's question or the answer once she finishes typing it. But Nausheen asks, are letters of reference from volunteer work accepted for CARMs? So technically, no. The letters of references should be from essentially electives or observerships that you've done. So I guess volunteer work could be essentially counted as an observership, but it really depends what type of volunteer work you are doing in the hospital. So if you're a volunteer, such as administrative assistant in a hospital, those letters of references generally are not accepted for CARMs. They need to be a letter of reference from a work you did as an elective or an observership, ideally. Okay, so just to finish off Samantha's question, so essentially she has about 11 years of experience in Singapore and Sri Lanka in anesthesia. So ideally, in the Canadian medical system, they're looking for formal qualification. So if you want to go through to try and practice medicine in Canada in a subspecialty, for example, in anesthesia or ICU, the colleges are looking for a recognized qualification. So that would be a qualification from the US, the UK, Australia, Singapore, but you would have to have examinations written saying that you are qualified, or even Hong Kong for that matter, saying that you are a fellow or you have a specialist qualification in anesthesia or ICU. Just having experience alone and working as a house officer, for example, or a junior medical officer for 11 years doesn't necessarily qualify you to go through the practice ready assessment to become an anesthesia consultant in Canada. So the next question is from Ram Sharma. I graduated from India in 2012, thereafter working as a medical officer in a private hospital setup until today. Now I'm immigrating to Canada as a permanent resident next month, and I want to apply to CARMS. So his question is, and he has a pretty wide year of graduation gap. So ideally, you should be able to apply through CARMS, even with a long year of graduation gap, but your chances of matching into a CARMS specialty may be a little bit more difficult, just because you're now going to be competing with other candidates who have probably graduated more recently. And so due to the gap, what type of references are required? So ideally, if you've been out of practice or away from medicine for 8 years, the best thing I would do is recommend coming to Canada and seeing if you can do some observerships in Canadian hospitals and making physician contacts that way. And once you've done maybe 2 or 3 observerships here, you can approach those physicians for letters of reference so that you can apply to CARMS. So completing Samantha's question, am I under assistant physician category? So essentially, there's no such thing as an assistant physician. There are jobs called physician assistants, but you're not considered a doctor that way. So there's no such thing as an assistant physician here. So the next one is from Hermes, asking about USMLE Step 1 and Step 2 CK, and would that make a big difference in application to CARMS? So the knowledge you gain from those exams would probably benefit you in writing the MCC QE1, but just having those Step 1 and Step 2 CK does not have any bearing on your application to CARMS. CARMS does not accept, or none of the universities accept Step 1 and Step 2. So the next one is from Sahan about practice ready assessments. So essentially, practice ready assessments are essentially they're administered through different colleges in each province. So there are various provinces in Canada. So for example, British Columbia, Alberta, Manitoba, and Saskatchewan have practice ready assessment routes. So essentially what that means is you would have to show them your postgraduate qualifications that you've obtained from any other country, such as India, Singapore, Hong Kong, or any other country. And they would look at your application and assess it to see whether what you have studied and what your qualifications are equivalent to what Canadian standards are. And if they're happy with your qualifications, then what they'll do is they'll allow you to work supervised for a certain period of time. That's probably about 2 months, where you're working in a Canadian hospital supervised by another consultant to see how you actually work. And if you pass that assessment, then you'll be given a license to work in a specific province in that specialty. So the next one is from John Lee Joseph. I have completed my MD in anesthesia in 2017 with 4 years of postgraduate experience in India. Should I write MCC QE exam to join a job in Canada? So for you, if you've completed a formal anesthesia specialty certificate in India, you may be eligible to do practice ready assessment in certain provinces. So I would contact certain provinces such as British Columbia or Alberta and go through their practice ready assessment to see if they will accept your qualifications. If they accept your qualifications, then you may still need to write the MCC QE1, but at least you'll get sort of a guidance in terms of whether you can avoid going through CARMS or through the residency process again. So the next question is from Dr. Raghava, asking about other career options for MBBS graduates in Canada. So if you want to still continue working in the medical field in Canada, but you're not successful in obtaining a medical license to work as a doctor, there are many other sort of specialties that you can, or many other medical careers that you can pursue. So one of the closest things that you can pursue is called a physician assistant. And this is a new program in Canada where you're not a doctor, but you get the qualification to assist with certain medical procedures, work under the supervision of a physician. And some people also have limited prescribing rights to prescribe certain medications. And it's a relatively new sort of career in Canada. It's more prominent in the US, but Canada is also starting to have more and more physician assistants. In terms of salaries wise, they're generally pretty good. You can make maybe about $100,000 a year as a physician assistant. You'd have to go through that physician assistant program in Canada, which is about 3 years at certain universities. I know McMaster University has a physician assistant program, which is about 3 years. So that's also an option. Then other options there are you could go into nursing. And in nursing in Canada, you can start off as a registered nurse and then slowly work your way up to what's called a nurse practitioner, which is sort of a higher level nurse who works independently and also has limited prescribing rights. And then other medical careers include things like physiotherapy, occupational therapy. You could potentially get into pharmacy as well, but you'd have to do a 4-year pharmacy degree to do that. So there's many sort of options as an allied health healthcare provider in Canada. So Samantha asks, if I complete my MCC QE1, am I qualified to apply for a doctor job? So no, writing the MCC QE1 is just one step in terms of getting a license to practice medicine. So the QE1 is an exam that you need to, in order to apply for CARMS or specialty training, as well as if you go through the practice ready assessment. MCC QE1 is just one small component of the process to get a medical license, but MCC QE1 alone does not allow you to work as a doctor. So the next question is there any requirements of internship training of 4 weeks in psychiatry and pediatrics. Normally, we just have 15 days in psychiatry and 30 days. No, so it really depends on what you are applying for. So for CARMS, as long as you have a medical degree, there's no specific sort of requirements of how many days or weeks of pediatrics and psychiatry you did, as well as there's no formal requirement in terms of if you go through the practice ready assessment route for psychiatry or pediatrics, as long as you have your medical degree in the country that you're coming from. So Ram, yeah, so I'm not certain about the specific details of the requirements for psychiatry and pediatrics. I would, I, I'd have to look at that a little bit more in detail and get back to you about that. I don't want to give you the wrong information. But also practice ready programs are different in different provinces. So each province may have a different requirement of what exactly they want. So the next question is Samantha's asking MCC QE is not in place due to COVID. So there's no special exemption from the MCC QE1 exam. You will have to write it. If they are not offering it at the moment, that means you just won't be able to get the MCC QE1 exam now. But in order to apply for CARMS, you do need to get the MCC QE1, as well as certain practice ready assessment routes also need the QE1 exam. Because of COVID, things may change, but there's no exemption at the moment. And for MCC QE2, what you're asking about is MCC QE2 has actually been fully canceled, so you no longer need to do MCC QE2. So the physician assistant program from Dr. Raghava, the physician assistant program is a separate degree. It's not a master's degree or any other degree. You need to come to Canada and apply for that specifically. And it's essentially an independent degree that you apply. You don't need to have an Mbbs or anything. And it's a 3-year degree. So I think so Samantha's asking what I would suggest. If you really want to work in Canada, just from what you've told me, I don't know the details of your qualification, but one option is to try and apply for residency. The second option, you'll have to talk to the practice ready assessment people in the various provinces to see whether your qualifications would be accepted. I don't think so, because you don't have a formal anesthesia certificate in a specialty. Like yours is just through experience, I'm assuming. So the practice ready assessment probably will not work for you. If you're not able to get through into a residency program in Canada, the next option is going to the US. The US is much easier to get residency spots. If you get your qualification in the US, then you may be able to move to Canada after that. So the next question is from Hermes. Do you think someone with a good MCC QE1 score, good NAC OSCE, a good letters of reference, but no research has a chance in CARMS? So yeah, I think definitely you have a chance in CARMS. Research is not a mandatory requirement. The biggest thing in CARMS is, one, you want to have some good exam scores, and then that will sort of get you into the interview category. Once you're in the interview category, you're essentially equal with everyone else who has received an interview. Then you just need to perform well on your interview. So just make sure that you sort of highlight your strengths of the application. So with an MBBS, the next question is, with MBBS degree from India, can you get a job in Canada? So you can get different jobs. You just won't be able to work as a doctor in Canada. So you may be able to work as a lab tech, administrative jobs in hospitals, but you won't be able to work as a doctor. You also won't be able to work as a physician assistant. In order to work as a physician assistant, you need to have a physician assistant degree and have a license as a physician assistant to work as a physician assistant. So in hospitals, people with MBBS degrees could work as administrative assistants, lab technologists, things like that, if you have the experience, but not as a doctor. So the next question from Sahan is, I'm currently in Canada planning to write the MCC QE1, but just a question, I was also looking to do a master's in community medicine as a second option for teaching. How are the job opportunities for teaching? So there are job opportunities for teaching in medicine if you have a master's or PhD. Generally, you'll have to work in sort of research. So most people who work at universities are doing research as their primary job, and then as their sort of side job, they do teaching in either the medical school or any other sort of classes that are going on in the university. The other option with master's degrees is you may be able to teach in a community college, which is not as prestigious, but it's still a teaching job. So those are options for teaching in Canada if you have a master's or PhD. So I'll just wait for any other questions. So while we're waiting for any other questions, if you guys have any other, so I just recently started this YouTube channel to mostly sort of help physicians coming into Canada from overseas. So myself, I did my degree in Canada, and it took me a while to sort of learn the route to get back to Canada, and I was successful. So I've started this YouTube channel primarily to sort of share my experience, as well as share my experience as a physician in Canada. So if you guys have any other video ideas, please do leave a comment in some of my video comment spaces, so that I can hopefully work on those videos and share them with you in the coming weeks to months. So the next question is, how do you see the situation for MDs overseas trying to apply to PR? Are doctors in demand in Canada in this pandemic time? So, so the pandemic in Canada is largely sort of coming to an end. The number of patients that are hospitalized with COVID-19 is probably at an all-time low. And if the trajectory goes the way it is, chances are the numbers are going to be low, in the sense that there's not going to be an emergency situation that we need extra doctors. Now, keeping in mind, in general, the number of doctors in Canada is kept very limited by the fact that in Canada, all doctors work for the government and are essentially paid by the government. So there's no private hospitals in Canada. So the number of physicians is kept to a very all-time low, and a lot of the auxiliary work is done by other healthcare professionals. So nurses in Canada do a lot more of sort of the work that doctors would do in other countries. For example, in Canada, we don't have the concept of a junior doctor. We have people training in residency spots, and then eventually they become a consultant. We don't have the option of working as a junior doctor for many years in Canada, just doing sort of odd jobs like taking blood, writing discharge summaries, because all those type of jobs are done by nurses or nurse practitioners in Canada. So the scope for jobs in Canada for doctors is good if you have the right qualifications, but Canada is not looking for an oversupply of doctors just to fill odd jobs like they do in the UK, where you can work as a junior doctor for 10 years without getting a specialist qualification. The next question is MCC QE1 too much to crack? So no, the MCC QE1 is not a hard exam, but like any sort of medical school exam, you do need to study for it carefully and um, do a lot of practice questions. The way I prepared for the MCC QE1 was essentially going through my medical school notes, as well as going through a question bank called the Canada Q Bank, which basically has a lot of questions which are similar to what the MCC QE1 exam would be like. The next question was, can you guide me on how to get observership? So at the current moment, because of the pandemic and just the hospitals trying to maintain like only crucial staff in the hospital, observerships have been canceled. But I think coming from September onwards, observerships may be open. So the best way to get an observership is to go through each of the universities in the city that you may want to work in. So in Canada, all medical schools are administered by a university. So for example, if you want to try and get some observership in a Toronto hospital, I would suggest going to the University of Toronto's website and Googling University of Toronto observership in anesthesia or internal medicine, and then you should be able to get some information about who to contact to organize an observership. But chances are, at the moment, most places are not taking observerships, but I think from September onwards, they should be. So are there Health Canada jobs for MBBS graduates? So specifically for MBBS graduates, no, because the MBBS degree itself is not, other than a medical degree, it's not recognized, for public health. So most of the time, if you want to work for Health Canada in public or community health, you would probably need to do a master's degree in either public health or community health, and then apply for a job that way. But again, the MBBS degree would not allow you to specifically work at Health Canada. So the next question is, may I know the procedure to apply for residency? So to apply for residency in Canada, the first step is to make sure you have a permanent residency or citizenship in Canada. If you don't have that, then you can't apply for residency in Canada. If you do have a permanent residency or you're citizen in Canada, then you need to write the MCC QE1 and the NAC OSCE exam. You need to have 3 letters of reference. You need to make sure you have your MBBS degree that's in good standing. And then with all those items, you should be eligible to apply for a residency program in Canada. So I got a suggestion about making a video about life as a doctor in a local clinic. So yeah, I might, thanks for that tip. I might take that and maybe make a sort of day in the life video of for what I do in the hospital. So the next question from Ram Sharma was, what are the future prospects for naturopathic doctor? So I don't know the specific details of naturopathic medicine in Canada, but again, it is a licensed profession that you need to have a degree in. There are schools for naturopathic medicine in Canada. I'm not sure whether degrees from overseas, such as India or Pakistan or any other country, would be recognized in Canada for a licensed naturopathic medicine. So the next question was, how much does Canada Q cost and its validity? So you can go to the Canada Q Bank website. So they have memberships of 1 month, 2 months, 6 months, and a year. And I think the 1 year membership to gain access to all the questions in the Canada Q Bank is about 500 Canadian dollars. But it's definitely well worth it if you're serious about writing the MCCQE 1 exam. So the next question was, to apply for a practice ready assessment for anesthesia, let me know how to proceed. So it is quite a complex process. The practice ready assessment is administered by each licensing body in each province of Canada. So you'll have to contact each province specifically, the licensing body, to see what their requirements are. But ideally, they want you to have a specialist certificate in anesthesia. You need to have some working experience in the country that you're coming from. And then based on those, they will look at your qualifications and then potentially assign you to supervised practice to see how you actually work. And if they're happy with that, they will give you a license in that specific province. What I can do is to explain that in detail right now is going to take a lot of time because each province is very specific on what they actually want. So I can give you the links later on to each of the provinces' practice ready assessments, and the best way to do it is, because it's unique for every person's situation, is contact them directly and see what sort of requirements they have and whether you meet those requirements. The next question was, how can we get reference letters? So the best way to get reference letters is to do an elective or an observership in a Canadian hospital. So I would recommend contacting each university and organizing an elective or an observership for either 2 to 4 weeks. And then when you join that elective or observership, tell your supervisor on the first day that your intention is to apply for residency or some specific job like a practice ready assessment, and that you need a reference letter. And so they will actually observe you in the with regard to writing a letter at the end of your rotation for that specific purpose. So the next question is, I have experience as a medical officer in anesthesiology and got through MD anesthesiology Part 1A exam in Sri Lanka. How could I find an elective or an observership in Ontario? So, so in terms of doing, again, observerships and electives, is each hospital that you probably want to do an elective in, or each teaching hospital, is associated with a medical school. So, for example, if you want to do an elective in the city of Toronto, most of those hospitals are going to be associated with the University of Toronto Medical School. So if you Google up University of Toronto medical electives or anesthesia electives, there should be a contact detail at the Department of Anesthesia asking you to sort of email a certain person, and then they can organize the elective or observership for you. So, for example, in Ontario, there are multiple medical schools. So there's University of Western Ontario, McMaster, Toronto, Queen. So all those universities you can send an email to and find out who to contact specifically to arrange that elective. So the next question is it mandatory to have a postgraduate specialist degree to apply for practice ready assessment in any province? So in Canada, all all specialists have a specialist certificate. And in Canada, medicine is very, very highly regulated. So, yes, in order to apply for practice ready assessment, you do need a specialist degree, either in a specialist, some sort of subspecialty like cardiology or internal medicine, or even if you want to do family medicine, you still need a family medicine postgraduate degree. Just an MBBS alone does not qualify you for practice ready assessments. So the next question is, I've seen a lot of people suggest UWorld over Canada QBank, and what's your suggestion? So I recommend both. So when on my video about the MCC QE1 strategies, I recommended both Canada QBank and UWorld. The way I went about studying for the MCC QE1, this was back in 2013, was I only used Canada QBank. And for me, I thought the Canada QBank was enough to do well on the MCC QE1. But again, over the years, the exams have changed, and I've never actually used UWorld. I've just heard reviews of it is very good for the MCC QE1. So you could probably use both. But from my experience, I used Canada QBank, and I thought that was sufficient. But from other people I've talked to, I've also heard that UWorld is equally good. So it's really which you want to sort of invest in, and whether you want to invest in both or spend the money on getting both. So the next question is, you said that we need 3 reference letters. So the 3 reference letters that I was specifically talking about was if you want to apply for CARMS. So CARMS is essentially a central body that allows you to apply for residency programs at the different universities in Canada. And most programs want you to have 3 reference letters as part of your application for residency. So that's what I meant by 3 reference letters. So the next question is, do we need to complete QE1 and NAC to apply for a medical elective? So no, you don't need to have your MCC QE1 or NAC OSCE to apply for electives. You only need the QE1 and NAC OSCE to apply for the CARMS residency application, or if you want to apply for license through the practice ready assessment, you may need QE1 or the NAC OSCE. So the next question is, do you think there's some more IMG friendly provinces than others? So I don't know the answer to that specifically, but I do know some of my colleagues who've come from overseas through the practice ready assessment have been more successful coming through provinces such as Newfoundland, Nova Scotia, New Brunswick. I'm not sure why that is, but I think the number of physicians in those provinces are far less, and they're much more open to allowing overseas physicians come through the practice ready assessment. So the next question is regarding the reference letters. Do we need to have those reference letters from Canadian doctors? So in general, no. Those reference letters, when you apply for CARMS, don't need to be from Canadian doctors. But I would highly recommend to have at least one of those reference letters from a Canadian doctor, because that Canadian doctor is going to be able to compare you to other candidates from a Canadian medical school. And so when they're able to do that, that reference letter is more powerful to the program that you're applying for, because they can actually see that this doctor is actually equal or better than a Canadian applicant. The next question is, can MD pathology Yeah, so technically you should be able to be eligible for a practice ready assessment. I would again just contact the specific provincial licensing bodies to see whether your pathology postgraduate degree is recognized by them. So the practice ready assessment is not only the postgraduate qualification, is also what sort of experience you've had following getting that postgraduate qualification. So if say you worked for 5 years in India as a pathologist, that could go towards your practice ready assessment. So the next question is, where can we read ethics for QE1? So the best place to learn the medical ethics as well as the public health component of for QE1 is through using a book called the Toronto Notes. So the University of Toronto Medical School students essentially each year produce a book called the Toronto Notes. It's a very thick, almost dictionary-like book. They are available in hard copy as well as on the internet. You should be able to find PDF versions of them as well, where you can learn the ethics and public health component that are specific to um, Canadian practice in that book. So when you do a practice ready assessment, Samantha's asking what kind of assessment is it? Is it written, MCQ, or OSCE? And so the practice ready assessment is not specifically an exam. The practice ready assessment is you provide an application which you give them your medical degree, your postgraduate qualification, your resume with all your experience of what you've done in the last, say, 5 years or whatnot. And then they take this, they look at it, they assess whether your experience is adequate for Canadian practice. And then what they do is they say, okay, you can go and practice under the supervision of a Canadian consultant for 2 months, 3 months, 6 months, and that consultant is going to oversee your work for that 6-month period to see whether you are competent enough to work in Canada. So it's not a formal written exam. It's an on-the-job assessment where you have a consultant that oversees your practice and sees whether you actually know what you're doing. So it is not a formal exam where you sit down one day and write a certain exam. No, it's an assessment that's done over a period of weeks by a consultant that supervises your practice. So yeah, I will do a video perhaps regarding the practice ready assessment. It's not specifically an exam, but I can give some more information about what sort of the requirements are for each province, and hopefully that'll be able to help some people out. But with practice ready assessments, just as a reminder again for everyone, is it's unique in each province. So the best way to find out exactly what each province is looking for is to contact each licensing body separately and tell them your unique situation and they would be able to guide you better, because there's no one right answer for the entire scope of Canada. So my next live session, I probably will do it maybe in about 2 weeks. Today I'm doing it on a Sunday, and I know for some people it's probably not the best timing because a lot of my viewers are viewing from India, so it's probably Monday morning and they may be at work. So what I'm going to try and do is my next live session, I may do it on a Friday evening, so that'll be convenient for the Canadian people watching in Canada, as well as it'll be Saturday morning for people watching in India and Pakistan, or even Sri Lanka for that matter. So the next question is, does the score in QE1 matter for getting residency? So formally, they say the score doesn't matter. You need to just pass the exam. But I did residency in Canada, and I have spoken to a lot of program directors and admission sort of committees. And what they say is they do, in fact, look at the MCC QE1 score because it is one of the only ways to assess candidates who are coming from different countries um, objectively. And so they do look at the MCC QE1 um, in terms of granting people interviews. I'll just make sure some other people don't have any questions. So the next question was, there are said to be two pathways to becoming a doctor here. So I think the two pathways you're referring to are, one is to do your training from scratch. So that's applying through CARMS and doing your residency or your postgraduate specialist training again in Canada. That's one way. And the other way is if you do have a specialist qualification, such as um, internal medicine or anesthesia, you can, the second pathway would be the practice ready assessment pathway. So the next question is, can we get a sample question? So if you go to the Medical Council of Canada website, so I believe it's um, mcc.ca. That's the Medical Council of Canada website. There, you should be able to get a few sample questions just to get an idea of what the questions are like. Um, and then, if you want, there's also another way is to, it's a little bit expensive, but the Medical Council of Canada does sell practice exams as well. I don't know the exact price. It's probably about $100 for an exam, but they will sell practice exams. I would not recommend buying those questions right away, just because it's very expensive just for one set of exam paper. But if you've studied in the Canada Q Bank or U World, and then maybe about a month before the actual exam, I would recommend spending that $100 because it's a very big exam and you want to do well. Spend that $100, buy an example um, exam, and then write that exam as you would write the actual exam, just to sort of practice and see how you do. And that should give you a good idea of what the questions are like. So the next question is, can we connect with you on Instagram? Yeah, so I actually have an Instagram account which I set up. And essentially on that Instagram account, I'm just going to, most of the content on that Instagram account is going to be about um, sort of what life is like as a doctor in Canada. So I'll put up posts about things that happen at work. So my specialties in anesthesia. So most of the time in the hospital, I spend time in the operating room, um, or I'm in the labor and delivery suite, or I'm in the emergency room. So a lot of the content that I put on my Instagram, it's related to just life as a doctor in Canada. So if you guys are interested in seeing what life as a doctor in Canada is and see what medical practice in Canada is, please follow me on Instagram. My Instagram account is doctor .siva.mahalingam. So I'll just type it out here so that you guys have it. and you should be able to find me on Instagram there. The next question is it possible to get an observership online while I'm in India? So I haven't heard of any specific online observerships at the moment. Um, yeah, so at the moment, I don't think it is possible in Canada. So the next question is, if I fall short of Canadian standards in practice ready assessment over 12-week period, will they allow me to get some training there? Um, so specifically, no, they won't give you some training in Canada to the um, meet the standards. The only other way that I've heard of some people doing is they apply through CARMS for say if you're doing anesthesia and you want to do anesthesia in Canada, they apply through CARMS for an anesthesia training position. They get that position, and normally that anesthesia training position is 5 years. And sometimes, if you've had previous experience, they cut that 5 years down to either 4 years or 3 years, and so you finish that training in 3 years. But you would essentially have to apply through CARMS and get a training position before that happens. So the next question from Hermes is, what would you say is a considerable gap from graduation to applying to CARMS to still be competitive? So I would say, probably about 3 or 4 years is reasonable. And in that 3 or 4 years, ideally, you don't want to be completely out of touch with medicine. So, for example, if you've finished your MBBS overseas and you're working as a junior doctor for 1 or 2 years after that, and then maybe you spent 1 year um, doing research. And so altogether, that was sort of 3 years, and maybe 1 year you spent working, doing something else. I think that's reasonable. Anything longer away from your medical school may be detrimental to your exam to your application, just because you are competing with other students coming from the UK, Australia, the Caribbean, to Canadian residency programs who are basically straight out of medical school. And ideally, residency programs want people who are freshly out of medical school because they consider those people to be easier to train and mold into the specialists that they want them to become. So the next question is, to proceed through practice ready assessment in anesthesia, here do we need to be consultants outside of Canada? So specifically, that would be the best way to go through practice ready assessment, is to be a consultant in the country that you're coming from. So I've I know a few physicians who've done the practice ready assessment, and one of my good friends is from South Africa, and he was an anesthesia consultant in South Africa, and he worked for about 5 years in South Africa. And then what he did was he went through practice ready assessment through Newfoundland and worked in Newfoundland for about a year and a half. And then once he sort of got the experience in Newfoundland, then he moved to Ontario. But the ideal situation would be to work as a consultant in that specialty in your home country. So, and just to clarify further, so having 10 years of working as a junior doctor in anesthesia does not necessarily qualify you to become a anesthesia consultant through the practice ready assessment in Canada. So guys, just as another question, was the timing of this Q&A session um, convenient for you guys, or was it probably not convenient? Because I know today we don't have as many viewers. I think we have about 8 to 11 people at a time. But on my first session, I probably had about 30 or more people at a time. So I just get the feeling maybe the Sunday evening probably isn't the best time for everyone to join. So the next question from Dr. Nim Patel is there any way to get a job um, as a doctor or an anesthetist in Canada without the exam? So that answer is definitely not. You knew in Canada to work as an anesthetist, you do have to have your specialist qualification, and in order to get that, you need to write the Royal College of Physicians and Surgeons of Canada examination. Um, and to work as any doctor specifically, you do need to have a specialist certificate. So in Canada, what makes Canada and the United States unique compared to places like the UK, Australia, and India is in Canada, we don't have junior level doctors just working for life in Canada. So in Canada, if you're working as a doctor, you're either a doctor in training, so you're in a residency program, and that residency program, you need to finish that program within a certain time frame. So for example, in anesthesia, you have to finish that program within 5 to 6 years. And once you finish that, you are obligated to write the specialist exam, and then once you pass that exam, you become a consultant. There's no such thing in the United States or Canada as working as a junior doctor without having specialist exams under your belt. So the next question is that as an IMG, can we get airway assistant jobs if we have experience as medical officer of anesthesia? So I forgot to mention. So for anesthesia specifically, there's also jobs called so jobs called respiratory therapist or anesthesia assistants. And in order to do that, again, you need to have be a licensed respiratory therapist or a licensed anesthesia assistant. Those courses you can actually come and do them in about 3 years in Canada. So you become a respiratory therapist, and then you do a one more year of training and do a what's called an anesthesia assistant uh, course, and then you can work as an anesthesia assistant in the operating room. Um, but again, you need to be licensed to do that in Canada. And in order to get licensed, you need to do the specific course. You won't be able to just have anesthesia experience and get that type of job. So, in terms of the timing, thanks very much for the reply, guys. I appreciate that. So, it's been about an hour since we started. So, if you guys have any last minute questions, I can try and answer them. And then what I'll do is um, I'll try and maybe uh, leave some maybe about 2 or 3 weeks, and then I will arrange another live session, maybe either on a Friday or Saturday night, so that we can sort of be more targeted at more viewers and make it a bit more convenient for everyone. So the anesthesia assistant course, you initially need to do what's called respiratory therapy. So respiratory therapy is between 2 and 3 years. Um, and then after you've done that, then you do another 1 year course to become an anesthesia assistant. But in order to do anesthesia assistant course, you need to first become a respiratory therapist in Canada. if you're interested in that, leave me a message on one of my videos in the comment section, and then I can send you some more information about the courses in respiratory therapy and anesthesia assistant. So I live in Toronto, and one of the big training institutions is called the Michener Institute, and that's where most of my friends who are respiratory therapists have gone, and uh, it's probably the premier sort of place to study those courses. So I can send you a link about that. Okay, so I guess that's probably all the questions you guys have for me. So thanks very much for tuning in. Again, if you do have any further questions that you weren't able to come up with today, please send me a message either to my leave it on a comment on one of my videos, or my email address is also on my YouTube channel on the About section. So you can send me an email there, and I can potentially give you more information about your specific questions. And yes, you can contact me either through Instagram as well. Someone's asking about my contact. So yeah, either message me on Instagram, or I have my email address, which is dr.siva.mahalingam@gmail.com. And that's listed on my YouTube About section. And I'll try and get back to you about any of your specific questions. And you guys are welcome. Thanks very much for joining me on this Q&A session, and I'll try and organize one in the next couple of weeks, um, to go over more questions you may have. And if you do have any other video ideas, I'd really appreciate if you send me those ideas, either through email or on my Instagram, and I'll be sure to work on some of those videos and put those out on my YouTube channel. Okay, guys, thanks very much. Have a good evening, and hopefully, I'll talk to you guys soon. Thanks very much. Bye bye.